Long-term care facilities across Minnesota are in the middle of a serious battle right now. A majority of the more than 300 coronavirus deaths so far have been in places like nursing homes, assisted living, and senior communities.
That includes 10 of the 15 new deaths reported today. The growing outbreaks have one state lawmaker urging the governor to take action. As
Beth McDonough reports, that includes expanding testing and making it mandatory at all long-term care centers in the state.
80% of those who in Minnesota who have died from the coronavirus live in long-term care facilities.
Where folks are more susceptible because they live in a congregated setting. They're older in age and in poorer health, with a lot of staff coming in and out all the time. The Minnesota Department of Health keeps tabs on the facilities where exposures and infections have occurred. The latest list Tuesday identifies 111 sites. During the state's daily COVID-19 briefing,
we continue to see this as a priority population for testing because of their vulnerabilities.
Senator Karin Housley told me right now only residents showing symptoms are tested for COVID-19. She implores the governor to expand the guidelines and require mandatory uniform testing for patients, plus include staff who often work at a couple of facilities.
I think this is a good place to put our resources when you're talking about, we know where the hot spots are. We have the data now, so now it needs to be all hands on deck.
We're by no means where we want to be. We do not have the capacity to test everyone that we want to test today, but we have doubled that since a week ago.
The governor's goal is to reach 20,000 a day. The tests range from $50 to $150 each.
Would it be federal funding, do you think, or state?
The governor already has $1 billion in federal funding sitting in an account there, and then he also has some state money still sitting in an account.
She also said if more help and people are needed for testing, Senator Housley supports calling in the National Guard. In the newsroom, Beth McDonough, 5 Eyewitness News.
In fact, Senator Housley plans to bring this bill to state leaders Friday. We've reached out to the governor's office for a response to this, and they say they're working to get back with us, but did note the state has greatly expanded testing capacity. Today, the Department of Health also pointed out once testing is ramped up, these long-term care facilities need to be ready for the results, meaning if someone tests positive, they must be isolated and quarantined, and space will be needed to make that happen.